of neurogenic shock. Patient must be admitted in the intensive care unit for the best monitoring. After the airway is secured and ventilation is adequate, fluid resuscitation and restoration of intravascular volume often improve perfusion and neurogenic shock. Appropriate and rapid restoration of blood pressure and circulation may improve perfusion to the spinal cord, prevent progressive spinal cord ischemia, and minimize secondary cord injury. Administration of vasoconstrictors will improve peripheral vascular tone, decrease vascular capacitance, and increase venous return, but considered once only after hypovolemia is excluded. Dopamine may be used first if the patient's blood pressure has not responded to what is felt to be adequate volume resuscitation. A pure alpha agonist, phenylephrine, may be used primarily or in patients unresponsive to dopamine. Stabilization of vertebral fracture after adequate resuscitation. That's all for the video. We'll see you next time.